Entrepreneurially Thinking is a presentation of BioSTL and CET, Center for Emerging Technologies, with Rare Gem Productions, changing the way you view new ventures, including you on the pathway to success with your business in the St. Louis marketplace and beyond. Here's your hosts, Cheryl and Christy. Now let's get thinking.
Welcome to the Entrepreneurially Thinking podcast. Our goal is to energize your entrepreneurial mindset and create pathways for business success in the St. Louis marketplace and beyond. I'm Christy Maxfield, Director of Entrepreneur Development Services at the Center for Emerging Technologies.
And I'm Dr. Cheryl Watkins-Moore, Director of Bioscience and Entrepreneurial Inclusion for BioSTL. Christy, we are here again.
How are you, my dear?
Oh, I'm here.
Cheryl's been fighting a little bit of illness.
Gosh. But I am so excited to be with you and with all of our listeners because I think we have something cool.
I mean, we've done this with allergies. We've done this now with,
my God.
All symptoms. And we always have a good time, which means, if you're feeling a little low, we hope that this will help lift your spirits as well. And if you're feeling a little trepidatious, we hope that this will inspire you to step outside of your comfort zone.
Just as we step outside of our comfort zone very trepidatiously.
Well, I like that word. That's a good word. So we encourage you to carve out some time and hope that you have to think about opportunities and business goals in new ways. We want to peel away any limitations you might have in the way you're thinking about small business, working for yourself, or being entrepreneurial right where you are. As I've come to call it, entrepreneurially curious.
That's the term that I was missing from you. Entrepreneurially curious.
I'd like to say I've coined it, but somebody out there will probably tell me I didn't. So we want you to stay connected.
That they coined the internet. So
well, yeah. Yeah, we'll leave it at that because there's a lot of claiming of coining as of late. So we can stay connected with you and you with us and the rest of the Entrepreneurially Thinking community on all of your favorite streaming platforms. Find us on Facebook, Twitter, and on our website at entrepreneuriallythinking.com. Follow the hashtag ETHINKSTL.
Well, hey, if you live here in the St. Louis region, then you should all know that our city has been recognized as one of the top startup cities in the nation.
Yep.
I think that this recognition is not only for the vast number of resources we have to assist those starting their new ventures, but also for the different type of ventures being started in various areas, from IT, cybersecurity, fashion, agriculture, and life science, just to name a few. We've got more accelerators, I think, in this city.
Accelerator or no accelerator, I see a lot of fashion, I see a lot of food, I see a lot of, health and beauty. So folks are doing lots of different things.
Yes, and that's very cool. So today, we've invited two individuals starting tech-focused companies in the healthcare market. Melanie Igwe is a co-founder of ELLERASOFT, a digital health company developing software that will centralize a healthcare system's entire medical equipment assets data on one platform to allow for shared use and to improve equipment utilization across all facilities. Okay, what this boils down to is this a modified LoJack system for medical equipment for hospitals, okay?
Does that work for you?
Sure. It has a ring to it, so I'll take it.
We'll come back to that when we go. We come back.
It's not stolen equipment. It's just locating equipment in hospitals.
Well,
okay.
Yes, we'll delve into that further.
And then we also have Rachel Simon Lee. She's CEO and founder of Heartworks Videos. It's a very unique resource for surgeons. What she does is she takes and edits raw surgical footage into a concise, polished video with annotations and voice-over narration, thereby creating high-quality educational video content. This is amazing. So what you're going to hear today is their stories of how they found a need in the marketplace and how they're fulfilling that need and are creating new companies. These are not entrepreneurs that's been out there 20 years. These guys are creating companies right now.
Today, in the moment, as we speak.
And these are the stories you don't want to miss. So stay listening.
Now here's Make It Happen with Keith Sales Pro.
Today, what really drives you? What is it that you would do for free every day of the week, 12 hours of the day? We call that your passion. How do you turn your passion into a paycheck? As you look where you are in life, is it where you want to be? Is it a job going nowhere fast? If you are clocking in every day and hate your job, the people you work with or for, and even hate your paycheck, then you're committing career suicide. When we discover that thing that we love to do every day and truly enjoy it, that's passion. Passion is when your love of the job or duty supersedes a paycheck. Are you pursuing your passion? Today, remember, it can happen. It will happen. And together, we will make it happen.
Follow Keith Sales Pro on Facebook or Twitter at Keith Sales Pro, or visit his website at keithsalespro.com.
It can happen. It will happen. And together, we will make it happen.
I'm Melanie Igwe. My company is Illerasoft, Inc. And what thinking entrepreneurially to me means thinking big and thinking boldly.
So as Cheryl mentioned, these are early stage entrepreneurs.
Yes.
Melanie, you're about a year into your adventure.
Yes.
And Rachel, you're...
Months?
Yes. Right? You're one of those folks who, as we like to say, is still keeping the day job as you're building your company.
That's right.
Awesome. So we always talk to folks about how there's no right way to go into entrepreneurship. I myself quit my job and went all in when I did it. Don't recommend that. But it is one way to go. So we want to hear more about your own personal stories, what your companies do, and how you've chosen to step into this role of entrepreneur. So Melanie, can you start us off? Tell us, first of all, what is Illerasoft? I know we've talked...
What does that name mean?
What does the name mean? In addition to being a low jack for medical equipment, what else does it do? Because I know it does a lot more than that. So start us off, Mike.
Yeah, sure. So to start off with the origins of the name, Kwaku and I, my co-founder, we're both West African. I'm Nigerian, he's from Ghana, and a language that is throughout West Africa is Hausa. And in Hausa, Illera means well-being. So because we're software that's dedicated to healthcare, it means to be well. So
that's great.
Yeah, so that's the origins of that, and some, West African
Bring
pride.
Some cultural.
Exactly.
That's really cool.
Yeah,
absolutely.
And it's just special for us because there's very little representation of Africa, and I'm first generation, and Kwaku immigrated here, so to be able to have that in our first company is really cool and dear to us.
I like that you said your first company.
Yeah.
So that means there are many more to come.
Oh, you better know it.
Serial entrepreneur in the making.
Right. That's right.
So
tell us how you guys got started down this path.
Yeah, so actually, Kwaku and I had a very serendipitous meeting. So Kwaku has a background in healthcare consulting. So he had the utilization portion of our company kind of rattling around in his head. And in my last role, I was a data analyst for clinical engineering for Memorial Hermann. And I oversaw FDA safety recall, and I just wasn't happy with what we were doing. And I think the straw that broke the camel's back for me is that a patient died.
Oh, wow.
And unnecessarily. And, it was a struggle because I was actually 2 classes away from applying to med school. Yeah. I had studied for the MCAT. I was like, this is going to happen.
You were going down that road.
Oh, yeah. Totally. Yeah, because that's a huge thing for me is being able to help people on a macro level. And I felt that healthcare is kind of the best way to reach a lot of people in that. So I met Kwaku as he was validating the utilization, and he was like, we had a really, really great chemistry. Everyone that sees us together is like,
yes.
Wow, you guys. Yeah,
that's
so
really important.
I thought they were brother and sister.
Well, co-founder chemistry is really, really important.
So he was validating it, the utilization, and he was like, hey, and I shared with him kind of the issues with the safety and how this could be automated and improved. So along with our co-founder, Ross Shepard, who's our CTO, he also is very, very passionate with healthcare, especially since he's had personal things happen with his family and going in and out. So all of us kind of melding
saw
together.
The need, right?
Yeah, there's totally a need. And
what's the need in the healthcare? If you can talk to us about that. I called it the low jack system. Just so our listeners who are not in healthcare have an idea what you're talking about.
So that's about monitoring and finding and keeping track of the physical
the
asset,
equipment,
the actual
which is
equipment.
huge.
But there's a whole nother piece.
Yeah, but in healthcare, they lose equipment and systems all the time.
Right. So the problems that we're tackling are twofold. There's the financial, which is making sure that the maintenance and collection of the equipment is easier, right? Because there's operational as well as capital equipment expense that as you're like missing equipment or not utilizing it to its full capacity, you're missing out on funds, right? But the other part, which is very, very dear for me, is the safety part.
Yes.
There's not a very comprehensive safety management with respect to medical equipment. And unfortunately, because clinicians are running and gunning, they don't have the time to do it. Clinical engineers are given the software that they have to do the best that they can. And everyone's literally trying to do the best job with what they have. So in that, Kwaku and I saw the need from different sides. He's more of an operations, finance person, and I'm like, how can we help and save lives? And
Ross, your other co-founder, is the one writing the software, right?
Exactly. Yes, he's writing the software, but also very personally touched by it. And it's just funny that all of us have this vantage point that's converged to validate the problem in our own eyes. But what's been so grateful and I guess gratifying is the fact that when we go out to customers, they get it immediately.
Yes.
So that's a great thing, is that, you know, you watch all these videos about like product market fit, and it's kind of like, no, this was like a gaping hole that, that like if our solution is put on top of it, it can definitely save. I just like to say that we save lives and we save money for hospital systems.
That's fantastic. And Rachel, you're operating in the healthcare environment as well, identifying an opportunity where you can add value. So tell us about what you're doing.
Yes. So Heartwork Videos is a resource for surgeons who are educators and who take on the most unique and challenging cases and who want to utilize video production to teach technique and skill. So a little bit about my background, maybe?
Yeah.
Video production major, Webster University. I went to BJC on an advisement of a mentor to get my foot in the door because they do have an in-house video production team. And St. Louis Children's Hospital hired a pediatric cardiothoracic surgeon who said, I want full-time video production for this department.
So he's operating, or she is operating on babies' hearts.
Yes. So he is...
So tiny humans with delicate cardiac surgery.
He's a remarkable person with a remarkable brain. And
wow.
Just a talent. That's, just crazy. So I had to learn how to read a surgery and basically tell that story.
The narrative, right?
Yes. And so every time a surgeon goes into the OR, when they come out, they dictate an operative note, which you know.
Yeah, I know very well.
And so I would watch the footage, read the note, and just basically find the beginning, middle, and end.
That is, first of all, that's remarkable because it's a skill to learn how to, first of all, marry up what they're doing from a video to what they're saying in a narrative. So I think you told me it took you about a year to really get that that expertise, which is amazing.
Yeah, and the way I see it, anything you do every single day, you should start to be really good at it. I was doing it every day. I think it's a lot easier to teach somebody who is technically savvy what to look for and how to interpret that than the other way around. So I had been doing this work, and let me tell you, part of the reason why I still have my job is I love it.
That's awesome.
I absolutely love it. I love the people that I work for. The surgeon that I work for, Dr. Akasadi, he's a big thinker. He has an entrepreneurial mind. And so he has always spoken to me as if he truly believes that I will get it done. He has no worries. And
you're a colleague.
Yes, absolutely. And a friend. And, he asks me what my thoughts are, and he doesn't ask just to be talking. He actually takes it into consideration. He makes notes. So my introduction into having a business relationship with a physician has been fantastic.
That's great.
When other people's may not.
So how did you figure out this could be possibly a business for you?
So one of the surgeons that was there was developing an iBook, and so it was a textbook with interactive videos, trying to take that to the next level and be innovative. And he knew what I was doing for Dr. Excited. He said, can you do some of this stuff on the side? And I said, well, sure. And I was like, wow, he needs this. I'm making some money. Are there other people that need this?
There's a need, and here's the opportunity.
Where is the hole?
Right. Exactly. Where's the hole, Melanie, right?
And so I started to investigate and found out that there are more people that need this, and more importantly, to use it as an educational tool, because there are some common cases when it comes to pediatric congenital heart defects. As you hear with Jimmy Kimmel, his new baby boy was born with tetralogy of Fallot. That's actually not that rare, but there are variants, right? So when you get into some really complex cases, you have doctors who are seeing things for the first time ever. And sometimes all they can do is talk about it.
Well, it was interesting because when you and I met, Rachel was talking about this as a one-off, and I'm looking at her, and incredulously, I'm going, this is not a one-off. Are you kidding
This is
me?
why you seek mentors who can help you uncover pathways.
This is video content for medical schools, for nursing schools, for online educational video content. So I think it goes back to Christy's point of talk to as many people as you can, especially with mentors in the community, because they might be able to see something a little bit more broadly because you're so into it at the moment. But I think it's a great story to tell about how you both found there was opportunity in the market and how you're going to fulfill that opportunity.
Well, we often say to folks that you don't have to be a technical founder in order to be successful. And by that, we mean identify something within the purview of your field of expertise, but it certainly helps. Cultivating that entrepreneurial mindset so that you're constantly observing your environment and really looking for the opportunities to make improvement or changes or brand new solutions is really exciting. So we're going to spend a little bit more time talking about that when we come right back.
These can be stressful times. Many of us feel stressed just trying to get through each day. Not all stress is bad, but when we live with high levels of stress, it becomes toxic stress, and it may be getting harder to bounce back. Know that you have some support to manage stress and overcome the difficult things that may have happened or are happening to you. So take 5 during the holidays to learn new ways to respond to stress. You deserve to be alive and well. Find more ways to take 5. Go to aliveandwellstl.com.
My name is Brandon Walker, owner and operator of Positive and Productive Innovations. Entrepreneurship to me is building your own brand, working diligently, and sacrificing all for yourself and your last name and your family's legacy and lineage.
So we've been talking about identifying opportunities within your environment and how both of you have leveraged your personal experience and your personal talents in order to meet the unmet needs in healthcare. And we know that there's more need to go around. So tell us a little bit more about Melanie in particular. We know that Rachel is still working her full-time job and launching her startup. You started out similar. You're about 12 months ahead.
Yeah.
So foreshadow for her what it's going to look like.
Oh, man. Okay,
and start from, you didn't quit your job right away.
No, I did not. I did not. Kwaku and I had been literally in talks from like the beginning of like 2016. And it literally came to a head when we went and pitched for Arch grants. And, I had a long talk with my brother because I'm not going to lie, I liked my lifestyle at the time. I was in Houston where I have like family there, friends.
And you were working.
Yes, and I was working. And, it all came to a head after we pitched for Arch grants and we got it because I didn't expect to get it actually. I was like, okay, well, this is like a great exercise for pitching and raising money.
Right.
That's the way that the attitude that I went into it.
Talk to us a little bit off the record here about
It's just us.
That really the impetus, you tried to go after this inside your employer.
Yeah.
But they told you what?
Yeah. So I definitely saw, because overseeing it, I was able to look at like where the gaps were with how it was falling off with the safety and also the poor collaboration that we did not have with all of the different service lines and departments that needed to be identified when equipment was defective. And I was like, hey, we can automate this. And my boss told me, we don't have the resources for it. So I just decided to create my own resources to make this happen.
That's not an uncommon thing. We know other entrepreneurs who went to their bosses, said, let's do X, Y, and Z. And the answer was no. And they said, okay, I'll take it on myself.
Yeah.
You know what's interesting? I wanted a raise. I wanted to make some more money. And I thought, this is really cool. I think this could be great for other subspecialties. You know, we are a collaborative, so there are many hospitals. There are probably going to be many doctors that are interested in this. And I got the same answer, you know, in a roundabout way. And I think what has been most enlightening about this experience is that I had to change my idea and my way of thinking that I could do this by myself.
Absolutely. That's called an innovator.
And I think, you know, you can't be what you can't see. And so, you know, this is a full circle moment. I heard your voice on a podcast about Black Girl Magic, and I sent you an email.
That's right.
And I was like, she don't know who I am. Who is this black girl emailing me? And I was thinking,
she reached out.
I had a moment. I had just seen Hidden Figures for the second time. So, you know, I was like on the roof. I was like, I can be, you know, amazing. And
read the book. It's even better.
And so I was like, let me email her and let me see what she says. And I was like, you know, maybe I don't need to do it within the confines of this.
She's trying to read an MBA book, and I'm like, what are you doing?
Stop trying to become an MBA. Focus on your expertise.
Yeah, so I completely agree. You know, I have a super supportive family. Like, the reason why I'm able to work full time is that I have siblings that are helping me out right now.
That's
just being real.
That's awesome.
And when it all came to a head after we got Arch grants, my brother was like, look, you're built for this.
Yep.
Do it. And you're absolutely
so
right. It's
cool.
Yeah, it's one of those things where, like, you have to actualize that you are the success that everyone else sees around you. It can be challenging sometimes because if you are a very logical thinker, you're like, but this could go wrong. This could go wrong.
I don't have any health care. Speaking of healthcare,
right? I'm eating ramen noodles.
But I think what's special about you two, you hit the head on the nail. This is why Christine
Or the nail on the
and I
head.
do this.
Either way you want to say
What
it.
did I say? Whatever.
You know, it's all good.
But this is why Christine and I do this. Raising awareness around, if other people can't see you, these are two African-American women starting their companies. And if there's nobody else in the market that's doing this, it's hard to believe that you can do this.
Absolutely.
So
It's just also really hard to believe in a culture where earning a wage is how most people do have health care and put food on the table. And there's nothing wrong with being a wage earner. But to step outside that and really explore what it means to be an owner, a creator, a founder, those are different identities that we don't encounter on a regular basis. And it can't be underestimated how important that mental shift is. Because, you know, personally, I've been in an owner position and I still have troubles, you know, when I go back and forth thinking like, oh, is that really possible? Can I really do that? How big can I think? All of those kind of things. So kudos to you all for stepping out there. Actually, I need to know a little bit more about. So we thought about it, we talked about it, we did Arch Grants, and boom. Were you guys in the market selling before you went to got to Arch Grants, or was this really like still in the business planning stage?
Yeah, so Kwaku had a prototype for the utilization, and that's literally, he came to the med center and was testing it with me and trialing it out, and, you know, just through talking, it evolved. So there was something there, but we definitely have expanded that since, you know, receiving Arch grants.
And you found the right players. When you have a CTO who's a software developer, you come with your background with FDA and regulatory background, and then Kwaku comes with the whole operational pieces of it. And I think what's interesting, Rachel, with you were already making money.
I was.
Which is proof of concept.
Yes.
And you know,
right?
And not just from your full-time job. I'm talking making money with Heartworks videos.
And I'm very risk averse. And so
Me too.
And when I was making this money, I was thinking, this is cool.
Right.
This is great. We can
This
go
is
to
nice gravy.
We can go to Florida.
Right.
You know, and come back, and then I'll go to work on Monday. And
got to start somewhere.
And that shift really needed to happen where, as I wrote my business plan, I was like, I was making pennies.
Right.
I need to be making.
Not understanding your operational, your value of what you're offering.
Doing.
Absolutely.
That I am an expert. That no one else is doing what I'm doing right now in the way that I'm doing it right now. And I'm passionate about it. And I can get it done. And, you know, I love people. And, you know, all those qualities that other people, like you said, see in you that sometimes you don't really know.
Yeah.
And just to echo that, like, you have to. Like, there's an armor that you have to wear every day that, like, you're going to win at this, because there's going to be people that will not believe that you can bring your idea or concept to fruition.
Absolutely.
Yes.
Even if you've proven it.
Absolutely.
There's
haters.
Absolutely. Absolutely.
Yeah.
But you know what? That has been minimal, so I feel blessed with that. We've had it, but I really, really take all of that, the haters.
Yeah, they're there. I mean,
Right.
I dare you to find an entrepreneur who hasn't been told by somebody, you can't do that.
Exactly.
But I think, honestly, maybe this is a little weird. I think when you have those conversations where somebody challenges you at your core and you're able to stand up and still walk out with dignity and then take what are the nuggets that they didn't get? What is it that I did not translate or convey strongly enough to make sure that they got it?
Yes.
Because at the end of this journey, everybody's going to understand Illerasoft, period. Like,
and I think that's a valuable insight, because a lot
Huge.
You could take.
I have a whole class you can come and talk to, and then I can gather a few people on a street corner. I need you to preach that from every corner. I mean, because when we're in the role of
Absolutely.
mentor
Yes.
and we're challenging people, it's not because I want you to fail. It's not
Right.
because I don't want to believe you. It's that there are things here that I need you to explain to me. And if
Exactly.
you can explain it cold, good.
Right.
That's what I'm trying to prepare you for.
And I
Because you
think-
just don't get an Arts
Right.
grant.
Right.
Like, it's not just
Right.
like, it just doesn't.
doesn't happen that you walk in and say, okay,
It's
you're an arts grant
competitive.
winner. Yes, and it's competitive worldwide.
Right.
Not just from the region. And I think once you come into the region, this is where I wanted to talk to you guys, since you're now both building your ventures here, how important has the resources been for you, and what resources have you taken advantage of?
Or what's been missing. 'Cause,
Yeah,
you
what's
know,
missing?
We don't got it all.
Yeah.
Something that you said sparked a thought in my head of not having everything up front and having someone somewhere, you was in Texas, they're in St. Louis, that could see like past just your initial idea to like the second and third, possible fourth iteration of it. That is what's in St. Louis in my experience. Like, you were able to see it. I sat down, I talked to you, you saw me, I was passionate, I had a good idea, but you saw other uses for it. You saw
Bigger.
Yes, you saw bigger. And I think not only do people in St. Louis see bigger, they invest in bigger. They invest time-wise. I have met with 3 people who will say, just book time with me, I'll sit with you, we'll talk for as long as you want, buy me some breakfast.
Exactly.
And I'm
Breakfast food goes a long way.
yeah.
Okay.
And it's cheap.
Yes.
And it's cheap.
People are just willing to pour into you, and they keep it real. They say, listen, what I say is not gospel.
Nope.
If you don't think it's
Data.
going to work for you,
It's data point.
then,
Right.
don't use it. But if you do, I think this can help, and I don't want anything back from you. I just want you to be great. I just want you to succeed. Above all, I know that's kind of vague and broad. I'm from Nashville, so St. Louis has been my home since 2003, but I have found nothing but encouragement and love and opportunities like the Square One Ignite program, just things that you can literally show up to like that week, get something from. Like, take it back to your computer and then just, I can do this. This is phenomenal. This is great.
I heard about Rachel in your Ignite program when she first got into it, and then she came out with a business model. It was like, whoo. What is
I think she found something she was looking for.
I think she found something.
And Melanie's got a lot of head nods going
Yeah.
on.
Yeah,
So-
no, I completely agree. So St. Louis has been super welcoming to us.
That's
like,
great.
super welcoming. I'm just going to be completely honest. Like, I understand the challenges that Kwaku and I face with being African American co-founders. And I do not feel that, at least being in St. Louis so far, that's been an impediment to talking to people being interested in what we have, to us having a pilot going on with a hospital that I cannot discuss right now.
Yay!
Yes, I know.
We love stuff you can't discuss right now.
That's wonderful, because that's the biggest obstacle for startups.
Yeah.
is
Exactly.
to test their technology. And
Right.
that's great.
And in this short period of time, we've been able to develop, establish relationships, and we're piloting. And I just really owe all of that to this ecosystem and how much this ecosystem wants everyone to succeed. I completely agree with you. There's a lot of people that will provide resources and especially their time. Like, time is so valuable, and people here will give it to you. So, I mean, maybe I'm still fresh, so I have yet to see what's lacking, but I definitely can tell you that I'm really appreciative to be in this ecosystem, and I'm a person of faith. I just think that getting into Arch Grants was a huge blessing for us with the resources, the connections, just everything that we've been able to gain from it, and like literally like the growth that Kwaku and I have seen in each other. So,
and I always say this, because a lot of times, especially in the startup area and in bioscience, you rarely see a lot of African Americans, period, in bioscience. And I always tell people, you don't have to be a chemist or a scientist to get into the scientific or healthcare arena. You guys came at it at your own ways of getting into healthcare. Both of you are forging, I think, new opportunities for healthcare systems and for, people, surgeons, to be able to develop educational content. So, it's always...
There's lots of ways.
There's lots of ways to get into it. So you guys are shining examples of, hey, you came at it from different ways. Here's a great opportunities that you found.
One thing that is also great about St. Louis, which I heard on your sports edition.
You are listening.
He said, I believe, we are located within a day's drive of 19 major markets.
That's right.
Yep.
How cool is that?
Yes, absolutely.
The center of everything.
If I need to go, which I will have to, which I am going to do later on this month, to a hospital to show them what the technology can do, I don't really have to get on a plane most times.
You can get in your car and drive.
Yeah.
And especially in healthcare markets, I mean, we have a huge healthcare market here.
Yeah, you don't need to be on the coast.
No,
not here. I definitely agree with that. And then also just the introduction that you're able to get here is like huge, because being able to talk to CEOs and CFOs like that, that doesn't happen everywhere.
No,
Exactly.
it doesn't. It really doesn't.
And
so we're thrilled that you're finding the resources you need. And when you find those things that are missing, you'll let us know too, because continuous process improvement
Absolutely.
for the ecosystem. I think we're in charge of that as well. Did somebody give us that job? But no, I mean, it's just thrilling that you guys are finding that it's working, right? We profess that we're here to support entrepreneurs. I like to think that we're adding value, but to actually know that that's occurring for you is phenomenal. And that you're finding your different ways in. And what I'm also hearing, folks, is that, yes, Arch Grants can be a pathway to come in from out of town, but also you can be inspired by someone you hear on the radio and reach out to them, just like Rachel did, and start getting connected in ways that, the day before weren't part of your world. So,
what I really, really like with what Rachel said is that boldness. Like, I am super bold. I do not.
I love bold.
I have literally transcended to some boldness nirvana where
we're hanging out. We are totally hanging out.
Because when you realize look, I want our company to be a global brand. No one should be too big for you to talk to.
Absolutely.
So kind of going back to that mental shift and being able to be bold and talk to people like Cheryl, I mean, you are beyond accomplished. So it's kind of
she makes me look bad. But
I read your bio twice before I emailed you.
Right?
I'm serious. That's how I knew you were from Chicago.
Right?
Yeah.
She had peeped everything, right?
I
did. You have to.
Hey, appropriate stalking is part of the part of it.
Exactly. But you guys are phenomenal. Where do you see yourselves in the next 5 years?
So...
That's a hard question.
I know. I love it. I was going to ask you, what do you want your legacy to be?
Ooh. Oh, I'll answer that too.
Ooh.
Okay. We enter both.
Yes, go, please.
Well, in 5 years, I will have bootstrapped and had at least 600,000. I know that number because I just tweaked my business plan.
You did your financials.
And I did my financials.
Christy, there you go.
600,000. Which will be able to supply money for our organizational structure, all the hardware, software that we need, travel expenses, everything we need to run the organization with at least 2 other producers, that I won't have to be doing the work anymore, and that we can start to really strategize about other innovative ways to do educational trainings.
That's great.
Wow.
So,
great.
Legacy, I guess I'll go ahead and answer that. It is such a Hidden Figures type idea. I want more black girls who look like me to know that they have the opportunity to do something within video production, which is very white male dominated.
And they don't have to be the video dancers.
They don't have to be on the screen.
Right.
That whatever idea that they have, they can make it work.
Yep.
And that my family can have this forever.
Yep.
And that this will be something that I'm
you
known
can pass
for,
on.
and I can pass it on. And the main goal is that this is going to help save lives. Similar
Absolutely.
to you. If a surgeon can improve their technique and their skill, if a trainee, if a fellow can learn how to do a surgery before the patient ever is rolled into the room, and they are equipped with the knowledge and technique, and they are able to save a life, then
that's amazing. That's beautiful.
I hope one day when I have to choose a surgeon for anything, I'll be able to say,
man.
And how do you use Heartwork video as part of your credentialing?
Yes, girl. There you go. Part of the
Lord knows
credentialing.
every once in a while somebody's going to get cut on. So
Right.
you might as well be able to have a way of knowing it's a good cut.
Part of the credentialing process.
Awesome.
Yes.
Yeah.
So Melanie, tell us about your 5 year.
Okay, so my 5 year is this. There's 50,000 hospitalizations that happened last year due to equipment-related injuries, right? Mm-hmm. Hopefully, with Illerasoft being in a...
Hopefully?
Oh?
Not hopefully. You stepping out.
With Illerasoft.
With Illerasoft.
Okay. So with Illerasoft,
That's right.
With Illerasoft, we want to put a huge dent into that. We want to be in at least 135 hospitals within 5 years, significantly decreasing that and making sure that we're monitoring that to improve the safety of patients' lives. Like, that's a huge, huge, huge thing for me. And with that, we want to get into other parts of safety with respect to pharma and food traceability as well. So anything,
those are big areas.
Exactly.
Big areas.
As well as threat and vulnerability for network devices that could be potentially hacked.
You mean like over the weekend?
Exactly.
The ransomware that took down healthcare in the UK?
Exactly. Yeah. So that's where we see our future. And to be a global brand for health safety. That's where I see us.
In order to be big, you got to see big.
Exactly. You have to. And then my legacy, which is something that I literally had at 25, I had a crisis. Like, what am I going to be? And all this other stuff.
Just wait. It'll happen again.
Yeah, exactly. 1-5.
God, girl.
Yeah. So for legacy, improving the lives of African Americans and African people throughout the diaspora is super important to me. I want black girls, black boys, any person that is of African descent to feel happy and proud of their lineage. And I guess my foreway to doing that is this, but also really, really helping with education. That's a huge thing for me, and making sure that there's real access to education, healthcare, a lot of different things. So,
wow.
Yeah.
That's amazing.
Yeah.
You guys both have, I think, only the future holds. You can be whatever you want to be. Absolutely. The possibilities, and I never want to hear you saying, hopefully. It will happen.
It will.
It will happen. Absolutely.
Together, we will make it happen. Awesome. Y'all recognize that voice? Keith Sales Pro.
That's right.
Well, we have a diehard listener among us.
Yes,
we hope
do.
everyone else
Yes,
has now
we
set
do.
us to automatically download.
There you go.
And if not, I'm sending Rachel out to talk to y'all.
There you go.
I'm a podcast fiend.
I love it.
Yes.
Awesome. So, because everyone is listening, we need to make sure they know how to find y'all.
Yes.
So, where would we find Heartwork?
Oh, Heartwork. Yeah, I'll start. Heartworkvideos.com website. Heartwork Videos, Facebook, Twitter, LinkedIn, Instagram. And it's the best way to contact me.
Wonderful.
Good.
Melanie.
Yeah. So Illerasoft.com is ours. And then I have a LinkedIn page that's Melanie Igwe. And
Spell Illerasoft for us.
oh, yeah. ILERASOFT.
Perfect. Wonderful. Awesome. Well, thank you so much for taking time out of building your businesses.
You guys
to
are awesome.
Inspire us, and more importantly, inspire our listeners.
Yes.
We really had a great time with you.
Yes. Thank you, guys.
Same here. I love this.
This was great.
Yeah.
Let me know.
Hey,
So we're going to be checking up on you to see where you are maybe
you'll
in
be
a couple
back.
years or so.
You'll be
Now,
back.
right?
Yeah.
Even before
and
a couple
we
years.
may have to buy them a meal.
Yeah. It
And
has to
then
be
learn from
breakfast
them.
then
I can
because that's
eat.
cheap.
I was going to say, I can eat.
Yeah.
So
y'all
we're
better
going to go
come.
get some ribs and some macaroni and cheese.
That's why I said breakfast. See?
Oh, good.
See?
Or some Nigerian food.
I know, right?
Some fish and some...
Ooh, yeah.
Really do it up here.
man.
Yeah.
I'm in.
Oh, yeah.
Well, you guys can find us out in the world eating our way through entrepreneurship. Thank you so much.
Thank you.
Thank you.
Thank you.
Changing the way you view new ventures, igniting your thinking about entrepreneurship. It's entrepreneurially thinking. Get connected and discover more. Visit our website for show notes, resources, information about our guests, upcoming events, and of course, all your favorite episodes. If you have any questions, be sure to leave them for us in the comment sections, and be sure to leave us a 5-star rating on iTunes. The best way to show love is to share. Let everybody know that you're thinking entrepreneurially. So visit our website, entrepreneuriallythinking.com. #ETHINKSTL. Entrepreneurially Thinking is another positive production of Rare Gem Productions. Thanks for listening.